But realize though that it doesn't really fill that. What you're doing is you're just putting a cover over that hole for now. And what happens is, because when we aggressively engage with others, they're only going to tolerate it for so long. And then they're going to take off, which can then lead to this sense of abandonment or this fear of rejection. And when that adds to it, it's like removing that cover, right? So now that hole's back, that emptiness is there, but you felt like it was covered. Stay with me. You felt like it was covered when you were angry, when you were engaged. Hi, and in this video, we're going to talk about struggling with emptiness and how to get over it. So by the end of this video, you should have a good conceptualization of what BPD emptiness is like if you experience it, and how it's different from major depressive disorder. So first and foremost, let's get into what is emptiness as it relates to BPD. Now, BPD is borderline personality disorder, and one of the criteria or components is this internalized sense of emptiness, and it's this chronic feeling of emotional numbness. And individuals with BPD, this is pretty pervasive for them. So they experience this sense of sort of a void, this inner void. It's like a hole that can't be filled, and that can cause individuals to feel emotionally numb. And it can lead to difficulty identifying various emotions. Identifying emotions in others can be impaired as well. And it can lead to a disconnect between their emotions and their experiences, because this internalized sense of emptiness can be so expansive, and it's not like it's locked in, right? Like a set hole that you might see in the ground, right? Is that it can grow over time, so it can expand, but with treatment and awareness, it can contract as well. And that is important to know. If you experience these components of emptiness and that emotional numbness and that difficulty reading emotions in others because of your own difficulty identifying your own emotions, by identifying your own emotions, you can actually lessen that void, that hole, and we can help contract it. Now, this can often lead to individuals also having this unstable self-image where they're not really sure who they are, because we use our emotions to help understand ourselves as well as understand others and the experiences that we have. So this emotional emptiness, that a lot of folks with BPD, but also in other conditions as well, we can see it in PTSD. You can see it in major depressive disorder, but it's different, and we're going to talk about that in just a little bit. But I think that individuals with BPD is that you have this sense of, why do I not have this sense of fulfillment? That no matter what I do, I don't feel connected to it. And that lack of connection can very much be attributed or connected to not knowing who you are, not knowing what your interests are, not knowing what love feels like, not knowing what a connection feels like, what passion feels like. And a lot of times in these situations is that it is easier to identify a relationship upheaval, whether it's with your partner, your friend, coworker, whatever it is, because these are so extreme that this just enormity of the experience, of the anger, the rage, the frustration that you feel, that you have this false sense of believing that that emptiness has been filled because you're so revved up. And anger is pretty intensive, but we have to realize that anger isn't really an emotion at all. It's a combination of other underlying factors, meaning that anger can't just stand on its own. Anger isn't anger for anger's sake. Now, it feels that way, absolutely true. And I have videos on anger. I'll put a link right here so you can check it out. But also that anger, as it associates to emptiness, it gives a false cover to that sense of emptiness. So when we maybe just aggressively engage with our partner, wife, friend, whoever it may be, we feel like, okay, so this I feel, this I know. So you're not emotionally numb, you're in a split. So you're in the extreme end of it. But realize though, that it doesn't really fill that. What you're doing is you're just putting a cover over that hole for now. And what happens is, because when we aggressively engage with others, they're only going to tolerate it for so long. And then they're going to take off, which can then lead to this sense of abandonment or this fear of rejection. And when that adds to it, it's like removing that cover, right? So now that hole's back, that emptiness is there, but you felt like it was covered. Stay with me. You felt like it was covered when you were angry, when you were engaged. So what happens is that you're at a higher likelihood to act out in anger, to express anger, frustration. So then over time, you prime yourself on a continual basis to have an angry response. But the problem with that is that those angry responses, and as they become more habitual, you're actually increasing the probability of exactly what you're afraid of, which is abandonment, rejection sensitivity. Right? So by doing that, you're actually creating what you fear, but you're not filling the hole. For a moment or two, you feel like you are. And I do understand, a lot of my clients will report this too, that, well, it kind of feels good because it makes sense because I don't have that emptiness. And I totally get it. I totally get it. Problem is that it actually leads to an exacerbation, of making worse of what you're actually afraid of. And that becomes the problem, is that emptiness attaches to that unstable self-image, so you don't know who you are, so you attach on to the emptiness to try to get an explanation or to feel something, but it's a false sense of emotion or feeling full, so you engage in it more often, leading to exactly what you're afraid of, which is abandonment and rejection. So what do we do about this? Well, there's a lot of things you can do. Not only recognize when it happens, you have to define what emptiness feels for you. And that can be really tough because emptiness is such a broad term. Is it hopelessness, helplessness, worthlessness, the three main constructs of depression? It very well could be. But it doesn't mean that emptiness is depression, because individuals who experience BPD traits, symptoms, who have the full disorder, that they are likely to have these depressive spirals where there are components of hopelessness, helplessness, and worthlessness. But it doesn't create this massive push which drives you to a depressive episode. Now, if this is confusing, I completely understand. And if you want to learn more about it, I actually have my book, Complex Borderline Personality Disorder, which we directly address major depressive disorder, how you can work with it, and how you can treat it. And we're touching on some of that here. So we're going to dive in a little bit. But if you want more hands-on stuff where you can read, and there's as well as some management strategies in there you might find helpful, check it out. But what I want you to be aware of is that these are two separate components, but they can be confused, because a lot of times you could go into your psychiatrist or your physician, whoever your prescribing physician is, and you say to him or her, and you say, well, I just feel emptiness inside from BPD. It's not from depression. So what they do is they increase your medication. When they increase that medication, you still have that issue of emptiness, because emptiness is not directly connected, even though it sounds like it is, to depression. They're not really connected. So what we want to do is be aware first that they are two separate components, okay? Now, if we're going to deal with it, here's what we got to do. I want you to define what that emptiness means. Now, that can be really overwhelming, so slow down, right? You know the power of pen to paper. If you've seen my other videos, you know, big fan of pen and paper, which helps us slow down and really concentrate on what we need to focus on. So I want you to think of, okay, what are three descriptors of my sense of emptiness? Is it that you're not sure who you are? Is it that it's kind of this void, this shrouded sense of self, of other, of dreams, hopes, aspirations? Now, this is different because you're going to want to be pulled to those identifiers of depression. And what's going to happen is you're going to identify your depression, and that's great. And working on it, that's great. And those are all good things. But emptiness is a little deeper than that. It's a little more complicated than that. So we want to define that. Now, on my website, I have an emotions exercise that can help you do this. You can help identify those emotions about what's associated with that feeling of emptiness. And for a lot of my clients, what happens is that as we work on the attachment together, as we start to attach, through the intimacy that is built through a healthy therapeutic relationship, that emptiness starts to contract, right? That hole gets a little smaller. Now, that can create, remember, we talked about abandonment, fear of rejection. We know that BPD is like that stray cat. It doesn't want to stop being fed. So it's going to meow. It's going to get your attention, right? It's going to keep coming by the door, maybe scratching at the door, scratch, right? Give me attention, because it wants that hole bigger. And this is when we can have a lot of therapeutic interfering behaviors, and these are completely normal. So sometimes my clients get frustrated with me. Sometimes they think I'm not very nice, which I'm very nice. But BPD creates a distortion. And that distortion means you're not seeing things accurately. And we got to work through it. And because those fears are brought up of abandonment and rejection, that once things start to close, you're like, well, if I know what those feelings are, I got to deal with the negative ones too. And that might be too much, because it could very well be attached to a sense of emptiness, trauma, could be a sense of rejection, could be a sense of abandonment, whatever it may be. So we have to resolve those things. And that's why the therapeutic relationship can be really great, because in working with me, for example, so if you were my client, we'd be working together and we would push that unhealthy comfort zone. We would try to remake that unhealthy comfort zone into a healthy comfort zone, meaning that we have an open relationship. We talk about assertiveness, frustrations, fears, doubts, also those old maladaptive patterns that are so destructive, but we know they pull you back, right? It's like bungee jumping, really, right? You're attached to this cord and off you go. And then, right, you only go so far and it pulls you back. Now, it's like you're fighting, and this is really a great analogy for the emptiness and BPD, is that gravity, right, is your healthy self, that adaptive self. You're jumping. You're like, yeah, I'm going to get there. Gravity's pulling you, right? That's the adaptive sense. Come on down. But your BPD is that strap. Now that strap seems like it's a good thing, right? And bungee jumping it is. Not in our analogy, it's not, okay? So if you're bungee jumping, it's probably important to have that bungee cord attached to you. I'm not saying don't do that, obviously. But, so you jump, but BPD pulls you right back. So what we do in the therapeutic relationship is that we keep getting you, right, used to those things, closer to those adaptive patterns until you try them. And you don't try them once. You try them 2, 3, 4, 12, 82, 750, whatever it is, until it becomes habit. And when it becomes habit, it's not so hard. And you find that that bungee cord isn't always pulling you back. It's not always jerking you back up to the top, because you're able to land safely, and you're able to embrace those adaptive patterns. And you feel and recognize and understand how you feel and who you are. And that's the goal. Recognizing those things, embracing those things, and doing things for yourself to fill that sense of emptiness. And I know that it's really complicated. Don't get drawn to the anger. Don't get drawn into the false sense of feeling full. That's easy to do, but it also empowers BPD and that stray cat that wants to eat that food. It wants you to keep feeding it. Well, it's time to stop feeding it. We got to have that stray cat go somewhere else. And that's part of what we're doing here. I want you to try it. I want you to leave a comment. Also, going to put a link to an anger management video here that can help you out. And I hope you enjoyed the video. Leave some comments, and I'll see you next time. Bye-bye.